Clinical manifestations are also aspects of a disease. When we think of clinical manifestations, we think of signs and symptoms. A symptom is a complaint that is given by the person or patient with the disorder, whereas a sign is a manifestation that can be observed by the physician. For example, having difficulty in breathing and dizziness are symptoms of the disease. These would be complaints the patient would give the physician. An elevated temperature that can be measured, a swollen extremity that can be palpated, and changes in pupil size are objective signs that can be observed by someone other than the person with the disease. It is important to note that signs and symptoms may be related to the primary disorder or disease, or they may represent the body's attempt to compensate for the altered function caused by the pathologic condition. A syndrome is a compilation of signs and symptoms, and a complication is a possible adverse extension of the disease or outcome of treatment. For example, a complication of uncontrolled diabetes mellitus is the development of sores in the feet, and this is due to poor blood flow and nerve damage. Another example of a complication could be a person with rheumatoid arthritis taking a high dose of NSAIDs, and this leads to the destruction of the protective qualities of the stomach, and so the person may present with ulcers. When we think of disease, it is important to understand that the diagnosis is the identification of the nature and cause of a health problem. A physician will take a patient's history and obtain their accounts of their symptoms and the progression of the disease. A physical examination is done to observe for signs of altered body structure or function. Developing the diagnosis involves weighing competing possibilities and selecting the most likely one from among the conditions that might be responsible for the person's clinical presentation. An important factor when interpreting diagnostic test results is the determination of whether they are normal or abnormal. Normal values for laboratory tests are based on values that refer to the greater 95% of the population, meaning the greater majority of the population presents with a similar value. When we think of tests, we think of validity. Validity refers to the extent to which a measurement tool measures what it is intended to measure. For example, we would not use a blood pressure cuff and sphygmomanometer to measure renal clearance values. When we think of reliability, this refers to the extent to which an observation, if repeated, gives the same result. For example, a spectrophotometer with a faulty light bulb will give unreliable optical density readings. When we speak of sensitivity for laboratory testing, we are referring to the proportion of people with the disease who are positive for the disease on a given test or observation. This is called a true positive result. For example, if the result of a very sensitive test is negative, it tells us the person does not have the disease and the disease has been excluded out. Specificity refers to the proportion of people without the disease who are negative on a given test or observation. This is called a true negative result. A funny example of this would be from my graduate school friend, Dr. Zoe. When he suspected that his wife was pregnant, he would buy 2 pregnancy tests, one for his wife and the other for him to urinate on. The point of that was to demonstrate the sensitivity and specificity of the pregnancy test. It should be sensitive enough to detect human chorionic gonadotropin and specific enough to not cross-react with other hormones like testosterone. Of course, we don't think of the pregnancy as being a disease, though I do personally because the woman is carrying a parasite. But the point of the test was to show that Dr. Zoe's wife was pregnant, sensitivity, and he was not, specificity. To go along with this example, if Dr. Zoe had his wife take the pregnancy test too early in her pregnancy, the test may not be sensitive enough to detect the pregnancy hormone, and this would have led to a false negative. The health of individuals is closely linked to the health of the community and to the population it encompasses. Diseases that were once confined to local areas of the world now pose a threat to populations throughout the world, when we consider that people can traverse continents in a matter of hours. Epidemiology is the study of disease occurrence in the human population. Epidemiologic methods are used to determine how a disease is spread, how to control it, how to prevent it, and how to eliminate it. Measures of disease frequency are an important aspect of epidemiology. Disease incidence reflects the number of new cases arising in a population at risk during a specified time. For example, 10 new cases for every 1,000 individuals per day. Prevalence is a measure of existing diseases in a population at a given point in time. For example, yesterday 100 people out of 1,000 total had the flu. Today 110 per 1,000 people. Incidence and prevalence are always reported as rates, for example cases per 100 or 1,000. Morbidity and mortality statistics provide information about the functionality impairment on the body and death producing characteristics of the disease, respectively. Mortality statistics provide information about the causes of death in a given population. Morbidity describes the effects an illness has on a person's life. To relate morbidity and mortality to a disease state, I found this cute little cartoon shown here on the screen. It shows a person who is stressed. You will learn that long-term chronic stress can lead to cardiovascular disease. Stress has a high morbidity, but not necessarily a high mortality rate. Stress certainly impacts the quality of life of a person, but rarely does a person die from stress. For example, you studying for a pathophysiology exam certainly impacts your quality of life, but that does not necessarily cause you to stroke out and die. Another example your textbook uses is arthritis. People with arthritis have low mortality from this disease, but arthritis certainly has a significant impact on their quality of life, that is, high morbidity. When epidemiologists consider prevention of disease, there are typically 3 levels of disease prevention. Primary prevention is directed at keeping disease from occurring by removing all risk factors. For example, when a woman is pregnant, we would like her to be on a prenatal vitamin that is high in folic acid and vitamin B12. These vitamins are required for DNA replication. A deficiency of these can lead to neural tube defects in the child. Immunizations given to children and the elderly populations with compromised immune systems are also designed to help prevent communicable disease. Secondary prevention detects disease early when it is still asymptomatic, and treatment measures can cure or stop it from progressing. For example, when a woman goes in for her annual well woman exam, a pap smear is done for early detection of cervical cancer. Another example of secondary prevention would be a blood pressure measurement during an annual physical examination. It would detect hypertension, and the patient can be counseled for changes towards healthier lifestyle techniques. Tertiary prevention is directed at clinical interventions that prevent further deterioration or reduce the complications of the disease once it has been diagnosed. For example, chemotherapy would be an example of tertiary prevention. The chemotherapy targets rapidly dividing cancer cells and is used to hopefully halt the invasive nature of the cancer to surrounding healthy tissues. In class, we will discuss the organization of your clinical correlation projects. You will pick your partners during class, or you may choose to work alone. The criteria are: you will make a PowerPoint presentation and upload it to our course management system. The grading criteria, out of 50 points, includes reviewing the anatomy, about 1 to 3 slides, or more as necessary, worth 10 points. Review the normal physiology, about 1 to 3 slides, or more as necessary, worth 10 points. Review the pathophysiology, make as many slides as necessary, and this is worth 30 points. In the pathophysiology section, you should review the concepts I just discussed, such as what are the etiologic factor or factors, what is the pathogenesis of the disease, what are the morphological changes, if any, what are the clinical manifestations, what tests or tests are used for diagnosis, make sure you describe how they are done, and how do they work. What are the incidence, prevalence, morbidity, and mortality rates as they apply to the disease? What are the levels of disease prevention seen in a clinical setting? Please see me in advance of your clinical correlation due date to discuss possible topics. They should correlate with the material that is being discussed at the time when your project is due. Have a good day.